detector. I prepared a device consisting of a smartphone attached to mobile thermography cameras. Clear one. Patients can take a thermograph of their feet themselves using selfie sticks. Patients with critical disease who visited the diabetic foot outpatient clinic this device. They said that it was difficult to use because I was not familiar with smartphones, but after walking a lot, while earlier appeared, so it could understand that it needs to avoid overworking. And it was difficult to take a thermograph because a short timer. Moreover, it was difficult to identify risk findings. The device identified the daily habits of a patient. Diabetes educator can share information about the risk of diabetic foot ulcer using thermographic images generated by this device. This device might help to increase motivation for such self-care because thermography generates visual feedback in real time. However, it was for improvement. I am working on revising this system. Next, I have a video about thermography techniques, so please check it.
Aplikasi. Keren, keren.
Thank you very much. Sorry, maybe the time is coming, but can I continue my presentation? Let me move on to the next topic, shear stress. We found a relationship between the causes with sharp borderline and inflammation. And the cause with sharp borderline has an even age. So we summarize that not only pressure but also shear lead to the cause with inflammation. Then we conducted joint research with engineers and developed simultaneous measurement system of frontal pressure and shear stress. This slide shows an example of measurement using this system. Frontal pressure was increased in patients with CARS compared with those without. Reduction of pressure stress. Frontal shear stress can prevent calcium formation in neuropathic patients with diabetes. Then we developed on-site measurement individualization system for frontal pressure and shear force because patients cannot feel shear force due to neuropathy. The first one is an example of loose footwear. The second one is appropriate footwear. Red color means high pressure and lows indicate shear force. So patient can recognize their frontal pressure and the shear force visually. Through this process, the diabetic foot outpatient clinic has been developed. However, the effectiveness of the diabetic foot clinic system was unclear. So we investigated the instance of diabetic foot ulcer in the diabetic foot outpatient clinic as a clinical evaluation. 942 diabetic outpatient visited the diabetes foot outpatient clinic at the University of Tokyo Hospital between December 2006 and March 2017 were enrolled in this study. Instance of foot ulcers was obtained from medical records. As you can see from this table, the incidence of foot ulcers over 12 months was 0.2%, over 60 months was 2.4%, and over 120 months was 5.8%. This slide shows a result of the logistic regression analysis about factors associated with foot ulcers. Notably, the history of diabetic foot ulcers shows that the odds ratio is higher at 34.08. This slide shows the details of subjects with foot ulcers. Among those, one case visited this clinic 7 times. However, most of them did not visit our clinic. To sum up, the incidence of the foot ulcers over 12 months in this study was same as incidence of the Department of Diabetic Metabolism, though the rate of high-risk patient for diabetic ulcers was increased in this study. This system used at this clinic may be effective for prevention of diabetic foot ulcers over 12 months. The history of diabetic foot ulcers shows the odds ratio is higher at 34.0 per age. Most patients with ulceration did not visit the clinic for re-examination. If we could establish a system to make sure that the patient who had this history of diabetic foot ulcers visit the diabetic foot outpatient clinic, then we might be able to prevent diabetic foot ulcers from developing more efficiently. In this way, I did clinical activities and research at the university hospital, and based on our findings, I have conducted collaboration research with specialists of biology and engineering. I had opportunities to implement the preventive care for diabetic foot ulcer and outpatient system that we had constructed during the process in China and Indonesia. I intend to conduct my research based on clinical activities with globalization in mind. I would like to express my sincere gratitude to Professor Sanada and her members for the continuous guidance, and Professor Kadowaki, Professor Yamauchi, and Ms. Ohashi for providing me opportunities for clinical activities, and to Dr. Suryadi for giving me the opportunity for global researches. Here, I would like to end my presentation. Thank you for your kind attention.
Okay, thank you, Professor Makoto. Let's give once again a big round of applause for Professor Makoto Oe. Okay, thank you very much, Prof. Makoto Oe, for giving such informative and interesting presentation. Ladies and gentlemen, now we come to question and answer session. I would like to have 3 questions from the participant, please. Silahkan kepada Bapak Ibu sekalian yang ingin bertanya, silahkan mengajukan pertanyaannya. Silahkan. Silahkan kepada teman-teman atau Bapak Ibu sekalian atau adik-adik sekalian yang ingin mengajukan pertanyaan. Okay, right in the chat room we have 2 questions, Prof. Makoto. The question from Mr. Muftadi. He is from Stikes Banisale, Bekasi. The first question is, how many cases of diabetic ulcer or foot ulcer done with amputation in Japan? The second question, what matter or what condition has to do to amputate? The first question, how many cases of diabetic ulcer or foot ulcer done with amputation in Japan? The second question, what matter or what condition has to do to amputate? Maybe, okay. Please your answer, Prof. Makoto.
Yeah, thank you very much. It's a really good question. Actually, I'm sorry, it is difficult to answer the question for me because we have no data about the amputation rate, because we have no system to gather the such kind of data from the nationwide. So we have no data. Yeah, actually, and I'm so sorry. It is a little difficult to catch second question. What do you mean?
Ya, Prof. Prof. Makoto.
Pertanyaan kedua apa? Pertanyaan kedua apa?
Question, what's matter or what condition has to do to amputate?
What is condition?
Yeah. What's matter or
For
what
example?
condition has to do to
Wow. Mother.
Maybe from evaluation from examination.
Yeah. After amputation, the patient needs to, how can I say in English, but some special shoes or rehabilitation for the walking. But I think we have the issue about the shortage of the specialists for making shoes or rehabilitation. So I think we have some issues about that. Is it answer your question?
Sukarni, how about food care for prevention diabetic foot ulcer such neuropathic low circulation?
We have
Okay,
insurance system for
how about
prevention of
food
diabetes.
care for prevention diabetic foot ulcer such as neuropathic low circulation?
Yes, we have an insurance system about prevention of diabetic foot ulcers. So the number of clinics about the prevention diabetic foot care is increasing in Japan. Is it answer your question?
Pardon, sorry, Professor Makoto, my network bandwidth is low.
Yeah, maybe. We
Yeah.
have insurance system about prevention of diabetic foot ulcer. So the number of clinic about prevention for diabetic foot ulcer is increasing in Japan.
Okay, thank you very much for your answer, Prof. Makoto. The last question, maybe from the audience. The question from Mr. Rizal Mustaqim. He is from Stik Muhammadiyah Pontianak. The question is, I'm interested with your topic about prevention of diabetic foot ulcer in Japan. My question is, how can we get the thermography tools for detection the problem of DFU in Indonesia?
Okay, so her question is how to get thermograph devices sales.
Yeah.
Yeah, regarding the smartphone which attached to, thermography which attached to some smartphone is got from Amazon. You can get these devices from Amazon, I think. However, I'm so sorry, I'm not sure the Amazon is useful in Indonesia or not.
Okay. Have done, Professor Makoto? Okay, sorry, Professor Makoto. We have the last question. It's from Dia Ayu
Okay.
Lestari, Dewi Prabawati. The question is, I would like to ask to Ms. Makoto, the research conducted were so inspiring. Could you explain what kind of measurement to assess callus? Or is there any manual measurement you recommended if we want to assess callus if we don't have the equipment like your study? The question from Dewi Prabawati, Stik Singkarolis.
So what could you explain what kind of measurements to assess?
What
Manual
kind of
measurement
measurement to
recommended.
assess
Okay,
colors?
yes. Yeah, I
Or is
recommend
there any
to use
measurement?
sonography. Sonography. I want to use sonography. However, if you it is difficult to get a sonography, it is difficult to get a sonography for you. Okay, I will share my slide again.
Okay.
Please check the characteristics of calcium. I mean, like this. Discuss with, yes, maybe no information. However, such kind of calcium is to have inflammation. So please check the sharp or not in the characteristics of the calories.
Bisa dibilang gitu, ada nggak yang pakai tradisional di sana? Satu CS.
Yeah. Okay, thanks, Professor Makoto Oe. Maybe is there any question from the audience? We have 3 minutes left. Okay, Professor Makoto, maybe is the last question. Is there traditional medicine using in Japan?
Yes, however, it's not the measure. Yeah, some doctor use the traditional medicine. However, it's not measured. It's not common.
Pardon, please, Professor Makoto.
We have traditional medicine, Japanese medicine or Chinese medicine. However, it's not common.
Oh, yeah. Okay, thank you, Professor Makoto, for your information. Okay, ladies and gentlemen, we apologize. We have run out of time for additional question. Once again, let's give a big round of applause for Miss Professor Makoto.
Thank you very much.
Again, thank you, Professor Makoto, for your answer, and thank you for your presentation today.
Thank you, Prof.
Thank you, Prof. Makoto.
Maaf kepada partisipan, karena beberapa jaringan kami ada yang agak jelek ya. Baik, selanjutnya kita akan ke pemateri kedua. Well, ladies and gentlemen, we are going to the next speaker. Our second speaker is Mr. Suryadi, MSN, AWCN, PhD. He is chairman of Indonesia One of Tommy Continents Nurse Association, or INWOKNA. His educational qualifications are as follows. In 1960, he attained his Bachelor of Nursing degree from University of Indonesia. In 2004, he attained postgraduate degree from Faculty of Medicine One Management, Kanazawa University. In 2007, he attained doctor course from the same university of medicine, one management Kanazawa University, and in 2013 he attended his postdoctoral course from School of Nursing, Queensland University Technology, Brisbane, Australia. Now, allow me to welcome the second speaker, Mr. Suryadi, MSN, AWCN, PhD, to deliver his presentation entitled Update of Wound Care and Diabetic Ulcer in Indonesia. Please join me, Mr. Suryadi, with a round applause. Pak Suryadi, apakah sudah ada di ruang Zoom?
I'm in Zoom.
Sudah, Pak, sudah.
Okay. Well, ladies and gentlemen, please welcome Mr. Suryadi. The time is yours.
Slide saya.
Jelas, Pak.
From Kanada.
Mohon maaf, Pak Suryadi, suaranya kurang, bisa mungkin dibesarkan sedikit lagi. Mohon maaf, Pak, jaringannya mungkin Mohon maaf Pak, suaranya masih putus-putus Pak. Mohon maaf Pak, mungkin suaranya putus-putus Pak.
Ya, Prof.
Mohon maaf Pak, suaranya Bapak masih putus-putus Pak. Dari audiens atau mungkin partisipan tidak bisa mendengar suara Bapak dengan jelas. Mohon maaf kepada audiens karena ada kendala jaringan sehingga suara dari Pak Suryadi agak nge-lag ya. Sekali lagi kami mohon maaf kepada partisipan. Sekali lagi mohon maaf kepada partisipan sekalian karena adanya kendala jaringan sehingga ini jaringannya dan suaranya agak putus-putus. Sementara mungkin Pak Suryadi lagi baik. Ya. Suaranya agak putus. Pak Suryadi, apakah bisa mendengar suara saya? Bapak? Ya Pak, ya Pak. Mohon maaf Pak, suara Bapak masih agak putus-putus. Ya. Itu ada di mohon maaf kepada Pak Suryadi, apakah materi bisa di-share kepada panitia agar panitia bisa membantu untuk share screen materi Bapak? Share screen. Mohon maaf Pak, mungkin materi Bapak bisa di-share kepada
Halo,
halo, ya. Mohon
halo,
maaf kepada
Mr.
audiens.
Arsyad.
Halo, Pak.
Halo semuanya, halo.
Halo, iya Mas.
Apakah suara saya terdengar dengan jelas?
Iya Pak Rizal, suaranya cukup.
Alright, thank you. Jadi
Jelas Pak Rizal.
sambil kita tunggu untuk perbaikan teknis, I've got some questions. Ini door prize. Jadi satu pertanyaan untuk 10 orang tercepat yang bisa menjawab. Ada Rp50.000 untuk paket data. Oke, jadi panitia boleh dibantu untuk menentukan siapa 10 yang tercepat. Alright, so are you ready? Baik. Pertanyaan pertama untuk 10 orang tercepat. Sebutkan nama dan gelar dengan benar yang memberikan sambutan pada acara pembukaan webinar ini. Oke, jadi siapa? Boleh tulis di chat box. 10 orang tercepat dengan paket data sebesar Rp50.000. Boleh langsung jawab di chat box. Oke, saya ulangi lagi. Sebutkan nama dan gelar dengan benar yang memberikan sambutan pada acara pembukaan webinar. Oke, untuk 10 orang tercepat. Oke, bagaimana? Panitia sudah dapat jawabannya? 10 orang yang tercepat?
Harus kirim slide. Ya, ya.
Gelarnya juga harus benar ya, perhatikan. Yang salah ini. Gelar belakangnya. Oke, kita tutup dalam hitungan 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Oke, jadi sudah banyak di sini yang mengirim, nanti panitia akan menghubungi 10 tercepat. Oke, jadi yang pertama itu pertanyaan pertama. Sekarang kita ke pertanyaan berikutnya. Pertanyaan kedua masih sama untuk 10 yang tercepat. Berhak mendapatkan paket data sebesar Rp50.000. Pertanyaan kedua, be ready. Dari universitas manakah Profesor Makoto Oe berasal? Oke, 10 tercepat. Oke, sudah banyak chat yang masuk. Kita tutup dalam hitungan 5. 1, 2, 3, 4, 5. Oke, terima kasih. Oke, nanti panitia akan menghubungi siapa 10 tercepat. Jadi tadi ada 20 orang yang beruntung untuk mendapatkan pulsa sebesar Rp50.000. Nanti kami akan hubungi. Dan selanjutnya saya kembalikan kepada moderator, Nurse Asar. Time is yours.
Baik, terima kasih Pak Rizal. Sementara saya lagi mendownload materi dari Pak Suradi dulu. Baik, kepada partisipan sekalian, kami mohon maaf atas jaringan ini. Sementara kami lagi mendownload materi dari Pak Suradi dulu. Mohon maaf Pak Suryadi, bisa kembali ke ruangan Zoom Pak.
Oke. Siap.
Nah, ini suara Bapak sudah bagus Pak.
Oke.
Ya Pak, kami lagi download materi Bapak dulu. Ya, download materi. Pak Suryadi, apakah bisa menampilkan ulang PowerPoint-nya karena materi presentasinya? Oke, baik Pak, silahkan dilanjut. Nanti kami akan cek kembali jaringan kami. Terima kasih Pak, silahkan. Mohon maaf Pak, suaranya masih sangat putus-putus Pak. Mohon maaf Pak Rizal, apakah bisa mendownload materi dari Pak Suryadi?
Baik, boleh kirim ke
Coba
saya.
di-download Pak, saya lagi sudah ada di grup Pak, sudah ada di grup.
Oh, baik.
Ya. Dan mohon kepada Pak Rizal mungkin bisa dibantu leading untuk sementara seminar kita.
Okay, for everybody, we are apologize for this inconvenience due to the internet connections. We will be back soon once we've got our connection back. Oke, jadi mohon ditunggu sebentar Bapak Ibu. Dan untuk yang belum mengisi absensi, juga boleh diisi untuk absensi yang ada.
Sudah bisa.
Baik, mungkin untuk mempercepat waktu, because we are running out of the time. What about switching the third speaker? If Mr. Rekaya ready? what about switching our speaker? Okay. Okay, so please unmute Mr. Rekaya for the host or co-host. So untuk host dan co-host, Pak Rekaya sudah meminta izin untuk di-unmute.
Hello everyone, I'm here.
Boleh di-pin untuk baik.
Apa kabar Bapak Muhammad Rizal? Saya di sini ya.
Baik, Pak Rekaya. Pak Rekaya. Kabar baik. Okay, thank you very much. So,
No problem.
Mr. How's the weather, Mr. Rekaya? Are you in Malaysia?
The weather here
right
is,
now?
yeah, di Sarawak, it's actually wonderful. It's been sunny. You can see at the back, it's so shining all bright. We had quite a bad weather last week when it's continuously 4 days of raining, 5 days of raining. So this week has been good for us here. So hopefully di sana juga cuacanya elok juga ya. Cocok juga. Yeah.
Baik, tak ada hujan lah.
At the moment there's no rain this week. Last week was horrible. Last week like torrential rain, proper torrential rain for 1 week.
Right, so okay, Mr. Moderator, are you ready? Mr. Ashar? Mr. Rekaya, we are so sorry because of this internet trouble, because we are on the Zoom during the pandemic. Everything is unpredictable, including our connections, and we are apologize for all the participants.
Yep, that's the wonder of the IT technology when it comes to during pandemic, which probably I might be sharing at the moment in my slides. So yeah.
Mr. Ashar?
Oke, terima kasih Pak Rizal. Mohon maaf kepada seluruh partisipan atas kendala jaringan kita. Well, ladies and gentlemen, we continue our
Mr. Asher, I can hear your voice.
Selamat siang,
Mr. Ashar.
Dr. Kaya Gunda Kaya.
All right. We think we've got some internet trouble. Without further ado, please give surrounding applause for Dr. Rekaya Anak Vincent Balang for presenting his presentation. Mr. Rekaya, time is yours.
All right. Thank you. Thank you, Mr. Chairperson. I think it's a normal struggle for all of us dealing with this internet connection and all that. And first and foremost, I think probably the best advice will be while the session is running through, I would like to humbly request all of you to mute yourself. Otherwise, there will be a resonance of sound when the speaker is really talking. Yeah, so I would like to request humbly to all of you to mute your microphone so that there's no resonance during the conversation. Yep, right. Firstly, I would like to convey my gratitude and thank you to Dr. Suradi and the team for considering myself to be involved in this valuable webinar, should I say. I was a bit like doubtful about what sort of topics that I should actually share when it comes to this webinar, because the theme for this webinar, it's so specific. Is actually focuses on the wound care, and I believe and I perceive the idea of that all of you here are actually very specialized in wound care management, and my background is actually more to like to the nursing practice itself. So henceforth, I came with the idea, a topic that I would like to share. Probably you guys also highly encouraged to share your experiences as well while giving care to the patients and clients when it comes to wound care management during the pandemic. So most of my topics and the things that I'm going to explain and share with all of you today will be mainly about the concept and what sort of mindset that we should have and should be delivered when we're actually giving care to the patients when it comes to wound care management. Allow me to share my slides. Right. So before I go further on this topic, I just like to steal 1 or 2 minutes from all of you here and taking few data bites of your data to have a look on where is actually University Malaysia Sarawak located and how's our campus in these things. I'm actually the head of the department for the Department of Nursing and Faculty of Medicine and Health Sciences. I work at this university called University Malaysia Sarawak in Kuching, which is in the same Borneo with Kalbar. I'm the same island with Bapak Suryadi as well. So we are actually serantau, ya, seantero. So basically we are actually always communicating, and let me show you this video about my university for a quick minute. Let me show it to you. okay, I can't waste another 3 minutes to show you everything, but you actually can Google up and have a look on our beautiful campus, University Malaysia Sarawak, or we just simply call it UNIMAS. We do offer a lot of programs, and for those who are actually interested to go for PhD as well as master program, we do have that kind of programs that we can actually offer to all of you. For international students, we are most welcome to any interested individuals or applicants to go for our program. Right, I don't want to waste time promoting my university. I have to be focused on what I'm supposed to deliver today with all of you, and I understand with the amount of data as well as the internet connection issue that we're having now. So I guess I will go straight away to my topic. So as you know that because of the pandemic, the spread of the COVID-19 is actually greatly affected the way how we deliver the nursing care. And then of course there is not much of involvement one-to-one or so-called like a very therapeutic kind of connection between you and your patient, because prior to the pandemic, basically the clients and the patients go and see you face to face, right? And it's easy that you can get like a not erupted, like a constant response from the clients when they're expressing the problems, some issues or something to do with the wound that they're having and this kind of thing to you directly. And you can actually do the observation, the assessment clearly, and also transparency in a way like you can see it with on naked eye. But due to this COVID-19, there is some difficulty for all of us to access that, because the patients aren't able to go to your clinics or to your center, but as well as you cannot go and outreach the patients or the clients in the community because of the social distancing and all the SOPs that have been practiced in our country. So that's the problem that we should look at when it comes to wound care management. This is the focus that in my topic for today, because the previous two topics delivered by Professor from the Japan and as well Dr. Suradi will be more likely talking about the technicality of the wound care management and also sort of the technologies or new techniques of wound care. But my point of presentation today is talking about the concept, how we actually come up with the idea and plan so that we can continue giving care or deliver wound care management to the patient throughout the pandemic, right? Patients with wound issues represent extremely vulnerable population and with poor quality of life. And rather this is actually enhanced by this pandemic, where basically patient cannot go out and they will probably be recuperating at home and not much of movement. And this thing could actually proceed to the idea of the wound will be healing not that fast or not as what we expected. Not much of movement, the accumulation of exudate, for example, that not much of daily dressing will be done by the family not really sure how to do with it. So when there's accumulation of pooling of exudate, then it will decrease the rate of recovery for the wound care actually. So this patient must not be overlooked because of the irreversible consequences. So we have to look at so much things when actually we deliver wound care during the pandemic. Rather than that, of course, you have an idea of how actually to sort out this problem. Probably, what sort of the facilities of equipment or things that are available at home that actually can be transferred or used or utilized in doing some dressings or cleaning the wound, for example. But again, whether the patients or the clients or the family members, do they actually have that idea or grasp that comprehension of what actually the correct and effective wound care in order to continue the care that you have been given prior to the pandemic. All right. The inclination of the skin related to the COVID-19 symptoms is an area that should be put in the center of attention. And of course, we need to look at this because basically we actually out of touch from the client. So there is some distance problem. And the care should be shifted from hospital to the community care places. Could be another way that we're looking at when it comes during the pandemic to sustain the care of the wound. And of course, when you talk about pandemic, when you're giving care, definitely there's so many rules and regulations. First and foremost, you need to control the amount of the clients coming to your clinics or your center, for example, for their daily dressing, for example. Instead of daily dressing, probably now you might probably have to do 2 days to every 2 days or 3 days for the daily supposed to be the daily dressing, because of you need to control the number of people coming to your center. So that will be another problem that you can actually interfere because you're not sure, because it should be ideally that kind of wound, for example, maybe diabetic foot ulcer, for example, should be done by daily dressing, for example, but then you can't do that because of the limit number of people who can go to the clinics. And also, of course, it costs you a lot of money when it during the pandemic, isn't it? Because before this, you just need probably a disposable glove or surgical gloves, and maybe like a plastic apron just to protect yourself when you're cleaning the wound, for example. But now you need more than that, because you need like hand sanitizer, you need to wear face shields, you need to order masks and this thing, and that costs money as well for your center as well. And then, of course, when there's a more longer duration intervals between the dressings that you need to perform or the wound care that you need to deliver to the patient, that will be reducing the pace of the recovery. At the same time as well, the family members or the patient themselves realize that, not much of recovery input will be happening because of this condition. So that could be some frustration that could be experienced by the family members and the patients and the clients, saying that, not much they can do. They cannot go to the clinic. They feel a bit frustrated. They don't know what to do, how to do a proper, correct technique of wound care, for example, at home. There's no much of guidance and this kind of thing, because basically they are actually out of accessibility to go to your center. Even more now, you need to consider as well, rather than only focus on physiological care that you're giving to the patient, but you also need to look at the psychological care of the patient, right? Because they felt probably been left out of, maybe they feel that they're not be able to access the hospital or your center, for example. They feel a bit frustrated, and that could actually interfere or demotivate them to actually participate into your care. All right. If you look at this study by Tinelli et al. In 2020, they look at what things that have changed since the pandemic in terms of wound care. For example, like when you see the green and the orange, or is it the brown or beige, it represent the caregivers, means like nurses, doctors, and the below one is the patients and the caregivers. And it's divided into two types, different color, which is on the left, it's basically represent yes, and on the right is represent no. So there is 4 items that they asked on all these respondents, whether there's any changes in terms of impact of wound care. So if you look at this, when it comes to impact of wound care, a lot of the caretakers, even the healthcare personnel who involved in wound care management, agree there's an impact on the wound care because of what I have mentioned earlier. And then what about the maintain the contact patient and doctor? So the caregiver says, there is not much change. During the pandemic, surprisingly, 36 compared to 10 only say yes, there is some changes in terms of the maintain the contact patient doctors. Could be because the communication is not only limited to the face-to-face, probably through WhatsApp or through Zoom or through telephone or telemedicine, things like that. And the caregiver tend to see this kind of situation, means that they're still able to maintain the contact of patient of doctors. However, if you look on the below bar, on the gray colored and also is it brown? I can't remember. Okay, I'm quite colorblind here. So it's more likely to be like the caregivers and the patient say there is a changes when it comes to maintain the contact the patient and doctors, contradict to what the doctors and the healthcare personnel mentioned just now. It's not much change, right? But it's actually from the patient perspective, there is a change due to the pandemic when it comes to the contact of the patient doctors. The next one,
please show full screen, please. So full screen,
please.
Full
screen, okay. All right. Oh, you cannot see, sorry. Can you see it now?
Yes.
Okay, yes, great. Yes. Sorry about that. Okay, right. The next thing that I actually look at is actually the change of type of dressings. As you know, that I'm sure that all of you are expert in wound care management here, that there's so many types of dressings that are available, and actually there's a way that you can actually modify and recuperating in a way like there is inaccessible to your center, for example. So this study found out there is quite unequal in terms of yes or no for healthcare personnel when you look at the change of type of dressing during the pandemic. However, when you look at the caregivers and the patient, they said there's not much change actually compared to yes, not much change. So there's something interesting in terms of this finding that from this study. And last but not least, they're looking at what happened in terms, is there any changes in medical therapy? And the healthcare personnel says that not much. Majority saying there's not much of change of medical therapy, right? Same goes to the caretakers and also the patient. So you can see there is some interesting finding from these studies looking at what sort of changes in the wound care during the pandemic, yeah? When you look at the challenges of working, being a nurse, like all of you here, that working on the during the coronavirus disease in 2019, for example, it's a complete new territory for all of us. It's quite a bit shocking, particularly at the first phase of the pandemic last year, that everybody were like so nervous and anxious about what they're going to do in this kind of thing. Everybody's shocked because never in our life that we actually experienced this kind of situation before. And slowly after that, I think all of us, we are professional nurses, we tend to plan out what things need to do so that there's a continuity of care. So it's a complete new context when it comes to delivering care. For example, now we communicate mainly through the virtual, to the patient and also to the staff. And of course, the new changes, the usage of the new IT technology is quite exhausting as well, because some of me, like for example, person like me, I'm not an IT savvy 100% compared to some of you here. But the thing is that it took me a while to grab the knowledge and the skills how to handle the IT like Zoom and this kind of thing, so that I can communicate with my students as well with the patients and the clients. And also, of course, people are scared to go to the center and also to seek treatment face-to-face to your center. Maybe because of, or fear of being infected or infecting others. So they rather stay at their own home and, probably they try their best to actually to come up with an idea how to continue the wound care, this kind of thing. And of course, being a nurse as well, we witness the patient experiences, the difficulty that they're having, not only because on the physicality of the wound, but also in terms of a holistic perspective for the clients. You need to talk about the money, how far they are staying, how's the housing, living arrangement. Some of your patients probably their loss of the income because of the pandemic, so they cannot afford to pay all the dressings, equipments that actually should be used for their wound care and this kind of thing. So there's so much thing that we should actually look at when it comes to this, yeah. And then the relationship between the patients and the healthcare providers. We are trying our best to engage. Even now, like we're having problem with engaging ourselves to the session because of the interruption to the internet. So this thing can make us, as a chaotic thing. But I hope that we're quite resilient to go through this, yeah. And I like to quote this, and I found this like a few days ago. This is from the World Economic Forum COVID Action Platform, and it says there's 5 skills that researchers, the employers are looking for right now. So this is quite applicable for us being a nurse, right? What sort of skills that we need to have to counter, to go through this pandemic? If you look at it, like out of 60%, the things that you require is actually communication and collaboration. Okay, assisting and caring, personal services and art communities. You can see all these nurses are covering these 2 components here, even to the up to personal services. So it's about 60% actually. We have to portray and demonstrate that in our wound care now during the pandemic. Okay. So how to come up with idea and to sustain or to establish the concept of wound care during the pandemic. So I have a long thought about how should I deliver this to all of you conceptually. And I found a keyword of champion, come from the word champion, the patient, the caretakers. Means like now, the nurses role not only actually doing dressing or introducing therapy or treatment to the wound that the patient have, but also we need to educate and prepare the patients and also the caretakers so that they can do it at home. So if they can do that correctly and effectively, means that they're actually helping and assisting the process of recovery sustainably, right? So that's why it is so important that you need to consider a lot of things. For example, it's a must that we have to be prepare ourselves in terms of remote learning. For example, like what we're doing now, demonstrating live and observe the patient performance via the IT technology. Other than that as well, we need to be good in communicating, right? Because communicating face to face is totally different than communicating with you during Zoom like here, right? I might find myself a bit amused because now I'm talking to myself in the room, but now I get used to it. Even though I'm talking to myself in this room, but now I'm talking to you, and I felt that I'm not alone, and I don't talk to the walls now, really. So I get used to it now, and I can find that hopefully it will be engaging to all of you. And then, of course, besides that, you need to prepare yourself as well, become very analytical about things. For example, when the patient sharing some pictures or complain on the text or something like that, you need to be able to be analytical on the complaints, on the things, on the status of the mood that they mentioned to you, right? And of course, you need to be a fast problem solver because things are so inevitable, unpredictable. When it comes to pandemic, today probably it's okay for you to go out. The lockdown is no longer established. And suddenly tomorrow, the government now saying that nobody allowed to go out home and everybody have to work from home. So you need to have that plan B always in your mind. And then when it's happened, so you know how to solve the problem. And also being a nurse as well, during the pandemic, you need to be a good team player as well as being a leader in care. Okay, so I read a lot of articles and these things. So I come up with the idea that campaigning the patients and the caretakers can be divided into 3 stages, which is the preparatory, implementation, and evaluation. Right? In the preparatory stage of championing our patients and their caretakers, you need to come up with a lot of programs, sessions, activities in mind. And these have to be contained of all these elements. Starting from, it has to be fluidity. Fluidity means like, it's quite flexible in terms of the content and also the way how you're going to deliver your content. All right. So that's one thing that you should look at. And also you need to be very goal-oriented, despite whatever the changes in the content of your session or the delivery of your content, it have to arrive to the goal that you have set up. And always, of course, even before the pandemic, we always practice this like patient-centered objective, which is we need to see and deliver and tailor the care that we give to the patient very individual. We cannot standardize everybody the same, right? There's so many things that you need to consider when you look at during the pandemic. How far is actually the patient caretakers from your center? Whether they have financial aid, whether the internet connections are great. Before actually to come up with the activity that you think you can deliver to the patient. And then you need to be alert and also attentive to diversity of the resources. What things that are available, the facilities that you can use to outreach your clients and the caretakers. Of course, we all around the world globally now, people are struggling with money and this kind of thing. We try our best to come up with idea or methods of cost-effective methods, approaches, and also to ensure that whether it's accessible for our clients and also for patients to their family members as well. Even though all these things you created considering all these components, but again, always come back to the acts and regulations. Like in Malaysia, for example, Telemedicine Act have been established in 1997. So basically whatever virtual consultation and all this kind of thing, it will be based on this act that have been established in 1997. All right. So this is one of the preparatory things that you can actually start to scratch your head to think about what you're going to do in terms of delivering care to the patient with wound. Okay. And during the implementation, there's so much thing that you can do, right? Listing first online education all the way, video calls, teleconferences, you can actually thinking about getting a session in the synchronous or asynchronous. Synchronous means you can do live what we're doing now, or maybe you can asynchronous, you can do like recorded YouTube and put it, and you can share the link, because sometimes your clients or the caretakers will not be able to access it live because of the internet connection. So it's quite wise to put your session in a recorded mode and then upload it on the YouTube. They can watch it later on. If they have any question, they probably can WhatsApp you and this kind of thing. So many things that you actually can come up with when you tend to implement some activities or sessions when it comes to delivering your wound care management to the patient. So I like to quote from Rogers in 2020, the new model of providing care during the pandemic, COVID-19 pandemic, right? Before the pandemic happened, the model of wound care is quite straightforward when what happened in hospitals and offsites and also at home, you know. But then if you look at it during the pandemic, it's the content seem quite similar, right? But the way you look at the arrow is like it tend to go to at home now, focusing more likely to be at home, not much to the hospital if you look at that. So because of this offsite and at home, it shows that, you know, we have to prepare our patients and also our caretakers to be more responsible, to be more responsive and responsible to their own wound care management at home. That's the reason why I like to emphasize that we need to champion our patient or clients or family caretakers when it comes to continuing their wound care management. Also, because of the limitation of number of people who can go to your center, you need to filter them or triage all these clients before you're actually thinking, right, they need to go to the center for an urgent thing. So there's some list of critical stages that actually you can use identify or triage your clients who actually can go to the clinic or center or who should continue their treatment at home by all this, like from critical, serious, guarded, and stable. Yep. If you look here from Dominant and O'Neill, it says like on the risk of high, those we need to see the critical deterioration and condition leaking. So I don't want to expand further on this on the details, but this is one of the way you actually can use to assess your patient condition remotely, and only then you can say that, right, he probably need to go and see me for more focused treatment and this kind of thing. If they're on the low, probably you can see them or just teach them virtually or remotely, right? So this is kind of one suggestion by Donovan and O'Neill in 2020 about the risk assessment process that help you to differentiate and plan out how you're going to carry out your care based on the patient's condition. Another things that I think Indonesia, I think most of the countries in the world have played this. I mean, have started and established telemedicine for so many years, but I guess during this pandemic, it has been re-emphasized and strengthened as well. So that's how I think now is the perfect time on the pinpoint that how telemedicine can maximize its capacity to help and assist the wound care management. Right, and also bear in mind as well, I think you guys have started communicating with your clients, your patients, and the caretakers through WhatsApps, video calls, you know, and then they even show you the live video calls and see the wound condition and all this, you know, how much they exudate, whether the dressing is too wet, you know, what's so, and then the patient probably can drop you a text, whether I can use this for the dressing or not, and this kind of thing. So basically, you already actually started your telemedicine on your own kind of way, basically. But the best is actually if you have a structured and planned sort of content that you have to deliver to the patient or the client will be great. Yeah, rather than working as a fireman when there's a fire, only then we take action. But as a nurse, I think we have to come up with the idea of that we have to have a preventive measures. And basically, if you come out with content, you put up some list up topics that your patients and the clients can have a watch, look at it, and then after that, if they have any questions, they can communicate with you through WhatsApp. That would be great. Yeah. And then when they're performing a wound assessment on telehealth, a lot of things that you can see actually to the video calls, ranging from the wound bed colors all the way to the recent blood glucose levels. So all these things actually you can see it quite, even though you don't actually looking at it on the naked eye, but I'm sure with the smart technology of the phone now, I guess all of you are from, you know, younger than me. Basically, you can see it. And also, I kind of like, you know, the research that shared by Professor Oku, is it? Okay, I can't remember her name. Sorry, I apologize for that. Makoto, sorry, Professor Makoto, regarding on the tomography that connected to the smartphone. This is one of the things that maybe we can consider to actually maximize the idea of actually working and communicating remotely with your patients and also caretakers. So However, there's some of the things that we actually have to take down when it comes to communicating or working remotely with the clients through, particularly on the modified telehealth care of chronic wound care on during the coronavirus, right? You can see the studies by this Bondini et al. It says that found the use of telehealth had a positive impact on wound healing. And also all the system study use telehealth communication between an expert wound clinician and nurse will be present with the patient. So it has a must. It's not like, the caretakers, but if the patient is able to be reached through that, they will be great as well. And then they found out it is important that to assess the appropriateness of telehealth means that we need to assess first. You need to have a assessment needs on the patient before actually you're introducing all this remote communicating or care to the patient, whether the internet connection or not, whether they have enough data, things like that. We understand the difficulty in our countries. For example, like people in the rural area, they find it's hard to get connected with the internet. So what's the other alternative that you can take in that sense, right? Probably you might need to come out. That's the reason why it is important for you to have a risk assessment in a way, all right? So the last stage of championing the patient and caretakers is actually you need to evaluate. You're done with implementation. Of course, you will be able to get a constant feedback and reviews. Very important to get constant feedback and reviews from your clients, from your patient, and also the caretakers. It's also good to get a second and third person feedback, maybe from your colleagues or from your other friends from other centers as well. All right. And also, you can get ideas in terms of the content from the expert background. For example, wound care, you have a specialist from like Dr. Suryadi, and I'm sure all of you have been trained as a wound care nurse. Basically, you guys can communicate each other with your friends, how to improve the content to make that the clients, the patient understand and able to engage to the content and follow what actually advised through the session from you. And then, of course, you need to actually look at, again, whether all the sessions, the programs or activities that actually you embrace to ensure that giving the care to the patient in terms of wound, it actually abide to a lot of acts and regulation as well. It is so important to check whether you're on the right track legally so that, you don't actually, subsiding or divert yourself from what you're supposed to deliver legally as a nurse, in your own respective country. So some of the things that you need to look at when it comes to championing patients and caretakers during the pandemic. First, of course, you need to check whether there's a use of secure encrypted technology like Google, Zoom, video calls, WhatsApp, Teams. I'm sure all this listed, but remember, we can do this, but you need to double check with your patients whether they do actually follow and have this kind of ability to actually connect with you through all these encrypted technologies. Of course, you need to review and keep abreast with clients' records, right? Because sometimes, the patient sometimes just texts you, you don't have any idea who is this patient, these things. So make sure that, you know and embrace who actually you're talking about, and the progresses and what actually happened, the profile of the patient very clearly, so that you deliver a correct advice or instruction to your clients. Sometimes you mix out wrong patient for the wrong treatment sometimes. So be careful. So that's the reason it is important. If you have electronic documentation, basically you can just blast it on the screen. You can check all the details from your patient from day one when they first referred to your center, and you know what's the progress and the current of the wound care actually. And then you need to consider the client in terms of the holistic perspective. Remember the social, psychological, also physical, all these things, rather than not looking at when they're coming to your clinics or your center, but looking at the home setting. It's very important to be considerate on that sense when you're actually thinking about to introduce remote caring to the patient and the clients and the caretakers. And then the standard of care and documentation requirement of televisits is the same as the face-to-face visit. You try your best. It's not going to be 100%, but like now what we're doing is actually I can consider about 80% that we actually talk, and I'm delivering talk to you, and I can see your live face on your camera now. So I feel like really good about it, to be honest. I have someone actually looking at me. Hopefully not looking at my beautiful face, but at least looking at my slides. That's the most important thing, isn't it? So that's one of the ways that you actually can get engagement and motivate the clients to continue saying that they're not left alone during the pandemic, that they cannot go and see you, but actually they still can do this at home, you know, in terms of sustainability in caring. And of course, those who are handling this kind of remote communication with the patient or deliver virtually kind of care to the patient, you need to be qualified and certified healthcare providers, right? So I'm sure all of you here are eligible legally to deliver all this to your patient, and also create a triage pathway for the treatment and care planning for the clients. Like the risk assessment that I shared to you earlier, one of the ways you can use actually to practice a triage and treatment and care planning to the clients. And of course, it is good to create a systematic and structured workflow so that people can use it. Like say, for example, it's about 5 to 6 of you in the center. If you share the same structured and systematic workflow, then it will be at ease, you know, because we don't want to come up with a commotion where basically you find out that your friend is telling a different way things works and compared to yourself. So it will be a bit confusing for the clients, the patients, and the caretakers. So you have to come up with a proper black and white, possibly a very structured and systematic workflow. How actually, if the patient having this kind of wound condition, we're going to do this, and you know, we're going to use the same triage system to all of them, so that you know there's no confusion to who you will see face to face or to who you can still communicate remotely when it comes to ensuring delivering of wound care management at home. I think I have shared this actually earlier, but you can see there's a changes here when it comes to when a pre-pandemic model of wound care is healing at all costs. But remember, when it comes to pandemic, it's inclusive, not only healing at all costs, but also prevention of hospitalization, reduce utilization in terms of management of wound. So it's an add-on, which is basically, if you look at it, is actually the triage. So this is one of the way how you could actually practice this in your center. Basically, you can use a very standardized triage system so that, you know, it will be more constructive and objectified when you come to looking at the condition of the patient, which one or who actually require an urgency and who is not. And in the sense that you can control the amount of people coming in, and also you can actually ensure that who actually can become more independent and accountable when it comes to their responsibility in taking care of their own wound, compared to those who maybe they have like some physicality or frailty. For example, for elderly patient, where probably they might need to go and see you at the center. So this is so important, that the difference between pre-pandemic and pandemic, there's another one specific add-on, which is the triage. Okay. So I think this is about the last bit of my my session. During the pandemic, you need to be being fully responsible for the patient well-being, because this is your duty. Despite you don't see physically your clients, your patients with the caretakers or caregivers, for example, but the engagement or whatever the works that you do during the pandemic, you have to make sure that the outcome of your activity, it has to be the clients and the caretakers felt and experienced that you are there still being responsible in taking care, being a nurse and also wound care nurse, so that they don't feel like disengaged from you. Because someone with wound, for example, or any types of illnesses or disease, for example, if they feel disengaged, you know, they feel that they have lost the support, not only from maybe from you, but also they feel like, you know, there's nobody actually professionally help them in that sense, and then that this could be actually demotivate them somehow. We don't want that to happen, because what we want actually by the end of it, we want a positive outcome when it comes to wound care management, right? So there's some few take-home messages that I would like to share with you, which is, you know, even though it's hard to convey or to continue or to sustain the wound care management, but make sure there's always a regular. Doesn't matter what sort of forms or methods or approach that you're going to introduce, rather than, you know, WhatsApp. Even a simple text through WhatsApp as well to your clients and patient will do some justice, and, you know, you will show that you take the liberty to be accountable and also responsible to the patient needs and care, you know, during this pandemic. You know, and using the IT technology will help the patient engagement and monitoring. And also, of course, I think before you actually manage, should be able to educate or preparing your or championing your patients and the caretakers, you need to embrace yourself with the latest updates, knowledge, and informations, and some readings that, you know, what sort of alternative things that you can actually offer to the patient, you know, when it comes to cleaning the wound or dressing, things like that, or, you know, some validity of alternative treatment to the dressings. You know, if there's any empirical evidence of it and say proven it's good, then probably you can suggest it to your clients and your patients. And the goal is to keep patients as healthy as possible by utilizing technologies. But again, the keyword, actually, you need to be able to triage or, you know, identify who's actually on the low and high risk and patient who's confirmed with positive COVID-19. That's the thing. That's the obstacle that we have to go through, regardless or inevitable that, you know, whatever the wound condition of the patients or the caretakers, you know, before actually you allow them to go, of course, you need to see the condition of the COVID-19 situation in your own respective area. I think that's about it. My slides for today. So I hope all of you have a bit of insights. Okay, maybe not much of technicality in my topics, but I hope by the end of this session that you guys have a little bit insight, you know, the idea and concepts, or even a framework, how to come up with your treatment or your care to your clients. Yeah. All right. Thank you so much.
Well, thank you very much, Mr. Rekaya, for your interesting and inspiring talks. That's really interesting. And also showing us your university. We will look up more about it. And then...
That would be great.
Okay, so jadi poin dari Pak Rekaya adalah bagaimana kita sebagai nurses adalah untuk continue giving care selama pandemi COVID-19 ini. Meskipun banyak disadvantages, kita harus terus peduli dengan customers kita, tidak hanya secara fisik, yang lebih penting adalah secara mental juga. Dan itu pendekatan yang kita bisa lakukan. Dan ada 5 skills that we have to embrace as nurses. Okay, dan mengambil hati pasien dengan persiapan implementasi seperti video call, WhatsApp, atau pesan singkat lainnya, tergantung pasien kita. Dan langkah yang terakhir adalah evaluasi. Dan tentu menjadi nurses yang creative and innovative. So setelah ini, so we're going to have the discussion sessions right after the presentation of the third speaker, sir.
No problem.
All right. So thank you very much again. And the next presentation it's from Mr. Pak Suryadi. Apakah sudah siap? All right. Si poinnya Pak Suryadi.
Okay. Nanti suaranya
bagaimana? Okay, so while we are waiting for the presentation to prepare, okay.
halo.
Ya, baik. Halo.
Ya, halo.
Ya Pak, sudah bagus suaranya Pak. Silahkan dilanjut Pak.
Okay. Okay. Okay, much for waiting.
Bisa show slide yang pertama. Ya.
Atau mungkin Pak Bonggi bisa menjadikan saya co-host agar bisa. Mohon Pak Bonggi untuk menjadikan saya co-host agar bisa membantu untuk share screen materi dari Pak Suryadi. Selamat siang, Pak. Bisa dengar suara saya, Pak?
Ya bisa Pak, bisa terdengar Pak.
Silahkan Pak, dilanjut Pak.
Terima kasih.
Sudah, Bu, sudah jalan.
There are the coronavirus there are some next slide. Different some
Halo Pak Suryadi, suaranya tidak jelas Pak. Suaranya tidak jelas Pak.
Iya tuh. Halo Pak, Pak. Kedengaran Pak suaranya? Kedengaran suara. Ya, Pak. Halo Pak, ya Pak, bisa Pak.
Hello, Mr. Ashar and Mr. Suryadi.
Halo Pak Rizal, bisa ambil alih untuk suara Pak, nanti saya
Halo,
bantu untuk
Pak Suryadi bisa dengar suara saya?
Bisa,
Baik Pak,
bisa.
silahkan dilanjut Pak. Pak Suryadi, bisa dilanjut Pak?
Halo, halo.
Ya Pak, silahkan Pak dilanjut.
Oke,
Next slide. Pak.
sudah jelas ya?
Sudah jelas Pak.
Okay, I want to start with diabetic and COVID-19. That we know about the further with I want to start with about
Pak Suryadi, mohon maaf, suara Bapak putus-putus. Bapak, mungkin Pak Suryadi bisa menggunakan handphone di Zoom-nya.
lewat handphone kah? Apa handphone aja?
Ya boleh Pak, nanti kami pandu untuk slide-nya.
Kalau di ininya gimana ntar? Oke, ntar ya.
Nah sekarang udah bagus Pak.
Ya, sudah.
Ya Pak, silahkan Pak dilanjut.
Oke, sorry. So So what the relationship with the diabetic and SARS or COVID-19? We can see that there is a relationship with the antibody or the pathophysiology with mechanism pathophysiology and with the immune receptor. So there is a connection with the pathophysiology and the immunity system patient with diabetic. So this is the getting worse if the patient had comorbid with diabetes and also compromised with the COVID-19, because the patient have many problems with the vascular disease. Mostly the patient with diabetics, they have increased thrombocyte of platelets. So this is dangerous for the patients if the patients have COVID-19. Next slide. Next slide. Slide berikutnya, Mas. Slide berikutnya.
Baik, ditunggu Pak. Sudah muncul Pak.
The patient with diabetic foot ulcer, they have dangerous. Why? Because the type of diabetic foot ulcer different with the other wounds. We can see the diabetics type wounds. They have such as arterial ulcer, venous ulcer, and mostly the patient with the vascular ulcer or with the disease, vascular disease, the dangerous term is the arterial ulcer. It means the ischemic ulcer. If the patient have ischemic ulcer, the patient have to do amputation, or the surgeons have to do amputation. And how we can choose what kind of the wound diabetic foot ulcer type, and then we can choose which one the treatment the best for the patients. Of course, depend on the patient condition or depend on the type wound with diabetic ulcer. For example, if the wound with the lower limb disease with non-self-adjustable with amputation or amputation for infection, necrosis, this is there is necrotic tissue with the metatarsal and the below knee or upper knee. This is dangerous, and the interventions we cannot do postpone, or the patient have to do operate immediately. And if the patient have venous ulcer, so we can consider the postponing, and also maybe the acute limb ischemia. So also this is the very dangerous. So don't postpone for the treatment or for the intervention. And with the patient with the peripheral vascular disease, also we can do postpone, or we can choose this if possible postpone. And mostly the patient with the surgical procedure for claudication, or the patient had diabetic ulcer and the patient also has claudication, the intervention is not so important, the emergency with the urgent. Next slide. Next slide. Slide berikutnya. Halo, Mas. And what risk of transmission during home care? So I focus on the home care because in our country, or Indonesia, particularly in Pontianak City, many cases with diabetic ulcer, the health provider can take care of the patient at home. So the risk phase in infection or infecting family members, this is very important for the health provider. concerned with the patient condition, and also the nurses have ensured the safety of themselves, patient, and well-being of their home and also family during COVID. Next slide. And about the challenge about the home care nurse. So social distancing while performing in home care settings is as possible due to vulnerable. The patient with comorbid are vulnerable, such as older people, pain with a serious disability who needs assistance of activity, daily living, and also bathing, or the patient needs all of things such as bathing, sports, and home care. So this is the patient, the health provider need to be concerned, need to be aware about their environments, and also if their family provide the care. So this is important thing that EPA is available, such as mask, gown, and gloves. The nurse have to use this. Next slide. Next slide.
Oke Pak, ditunggu Pak.
So if the nurses have to do or have to perform home care, the patient at home, slide sebelumnya Mas, slide sebelumnya. Slide sebelumnya, maaf.
Sudah Pak, sudah tampil Pak. Ditunggu Pak di jaringan Bapak.
Oke. Okay, wound care is essential for sustainable wound care patients who often experience with variety of comorbidities such as diabetes, hypertension, chronic lung disease, and obesity, whereas with the older people. Next. Berikutnya, Mas.
Sudah Pak, ditunggu Pak.
Bukan, kok susah banget slide-nya ya?
Delay Pak, mohon maaf Pak, agak delay slide-nya.
Atau dari saya aja share skin-nya ya kali ya? Gimana?
Boleh Pak, atau mungkin bisa Pak, bisa juga Pak.
Oke. Di stop dulu. Bisa lihat, Mas? Halo? Sudah bisa?
Bisa, Pak.
Oke.
Silahkan dilanjut.
Di mana tadi? So, if the nurses have to perform home care during pandemic, so this is the different on the appropriate communication. It means the nurses have to keep during communication with the patients, or maybe reduce dialogue or communication with the patient, and also adequate protections for themselves, and also keep the immunity. And also the nurses have to prepare about the transportation support and for nurses and family. And also during wound care, patients might be the condition make the nurses to be fair because the limitation of PA. Besides, the wound care is essential. It means that the nurses have to perform the nurses wound care during pandemic topics, and also the nurses is with the comorbid patients such as diabetes, hypertension, chronic lung disease, and obesity, as well as all the patients. Wound care is essential, not elective. Ignoring chronic wounds will have unintended consequences such as more emergency visit and hospitalizations. Wound clinics must reduce the risk of COVID and misinformation but not close. Or at doctors sessions. So they close the COVID-19
Ya, Pak.
Free in
berikan home care. Ya Pak, halo Pak. Ya Pak, sudah kedengaran Pak.
Halo, apakah suara saya terdengar dengan jelas?
Ya, terdengar.
Riza.
Baik, baik. Alright, so I will handle for these sessions. And thank you very much for Mr. Suryadi for your presentations. Okay, and then for the next session, we've got discussion sessions. So we invite Mr. Rekaya and Mr. Suryadi to join us. And then untuk Bapak Ibu boleh bertanya mengenai presentasi dari Mr. Rekaya dan Mr. Suryadi. Jika ingin bertanya, boleh ditulis di kolom komentar, sama seperti tadi. Dan mohon masih menonaktifkan audionya untuk memperjelas jalannya seminar ini. Baik, Bapak Ibu, apakah ada pertanyaan untuk Pak Rekaya dan Pak Suryadi?
Oh yeah, dear Mr. Rekaya.
Yeah.
Yes.
Yes, sir. When we talk about the telemedicine strengthen, telehealth, and so on that you explained before, is there any apa itu sopan santun ethically rules to use that telemedicine strengthen to take care of the wound patient by the nurse in doing that care. Thank you, sir.
Okay, terima kasih ya Ibu Indah ya namanya. Okay.
Yes. Sir.
Back. Yeah. Okay. Okay. Kalau if it with regards of general implementation of telemedicine within Malaysian context, there is an act that actually that people will rely on, which is they call it Telemedicine Act in 1997. And then it was revised again in 2012. We do have that act. If you Google up Malaysian Telemedicine Act 1997, it will list up down. But when coming back to your question regarding on whether there's any ethical consideration and act and regulatory, like if you saw my slides at the last one, which basically there is some elements that I did discuss about the elements that should be considered when you implement telemedicine or maybe doing some virtual advice or communication with your clients that could be set up in terms of the concepts. When it comes to the details, probably the best is actually you and your few of your colleagues in your center could come up with few of the ethics rules and regulation, what should you do and what you should not, and when and the correct and the best situation for you to execute. Means like you only, for example, one of the things that we come up with in terms of the ethic or also requirement to conduct a telemedicine means like the accessibility has to be on the notch. On the note for the clients, means that they have like accessibility to the internet. That's number one. If they don't have it, then there's no point of us doing telemedicine. And then as well as we need to assign people, the correct people, means like if someone with a wound care specialty to talk about or to give some ideas and advice to the patient with wound care, that's how is it. It should not be someone who's not a content expert. And also the best will be someone who's actually taking care of that particular client, maybe who should be responsible. And as well as you need to come out with a very structured plans, sort of activities that, you know, if the patient having this is the work system. That's why I emphasized earlier, talking about we need to have a systematic workflow where we actually run the telemedicine, basically when it comes to wound care management. I think Dr. Suryadi as well have shared, how is the work process that he recommended just now, which actually you can implement it as something like a component or the ethics that can revolving around the workflow that been suggested by Dr. Suryadi earlier. That's one of the way. Yeah. Thank you for the question.
Alright, apakah sudah menjawab Ibu pertanyaannya?
Sudah Mas Rizal. Memang banyak yang mungkin berkembang dari penjelasan yang diberikan oleh Dr. Eka ya, cuman barangkali saya harus mikir dulu untuk melanjutin pertanyaannya.
Baik,
Karena
baik.
waktu dan sinyal kita yang terbatas. Terima kasih,
Iya.
Pak. Terima kasih.
Baik, baik.
Terima kasih, Ibu.
Baik, pertanyaan selanjutnya masih kita diskusikan untuk Pak Rekaya dan Pak Suryadi. Untuk pertanyaan berikutnya boleh langsung dinyalakan mikrofonnya jika ingin bertanya, atau mungkin dikirim di chat box.
Actually ada satu soalan ya dari Ibu Atia, nurse
Yes.
Stickers Bani Saleh. She asked about the triage during the wound care ketika pada masa pandemic. It means like a triage maksudnya macam it's the same thing like when you go to A&E for example, you need to screen through who actually need urgent or required to see the doctor. I think it's the same concept when it comes to filtering or selecting clients or patients who should come to your center during the pandemic, because you need to control the number of people who come into your center, right? So you have to be very selective. When you selective means that when you select, you triage, you filter, you pilih berdasarkan dengan situasi keadaan luka ataupun wound condition of the particular patient, based on this criteria that I've shared on my slide, whether it's urgencies or moderate or not severe, this kind of thing. It should be classified on that. Then you can actually know who should still going to your clinic during the pandemic or who should actually still continue the treatment at home, for example. Ya, itu yang maksud saya berkenaan dengan triage. Ya.
Jadi boleh memilih tentang kondisi daripada pasien kita.
Betul, mengikut kategorinya ya, dari severe, mild to moderate begitu. Ya.
Baik, baik. Terima kasih. Thank you very much. And then any other questions? So we've got 5 minutes left for this discussions, please. Yes, anyone?
Rizal, mohon maaf, ada pertanyaan di room chat. Mungkin bisa saya utarakan di sini.
Boleh,
Ya.
silahkan Ibu.
Ya, karena mungkin pertanyaan nanti bisa untuk Pak Suryadi ya. Jadi ada mahasiswa yang bertanya tentang bagaimana untuk terapi gangren yang menggunakan belatung, gitu. Sama satu lagi, bagaimana untuk penderita diabetes, apakah ada korelasinya ketika dia mengkonsumsikan ikan gabus? Ya, jadi ada 2 pertanyaan dari mahasiswa. Mungkin bisa untuk Pak Suryadi, Pak. Terima kasih.
Baik, terima kasih Ibu. Pak Suryadi. Jadi ada 2 pertanyaan. Yang pertama tentang metode menggunakan belatung dan yang kedua tentang memakan ikan gabus. Boleh langsung dijawab? Apakah hal tersebut membantu dalam proses penyembuhan?
Okay, if we talk about the maggot atau larva ya, atau ulat for treatment in diabetic foot ulcer, this is important for clinician because the ones of technology in wound management, once is use maggot. Jelas nggak Pak Marizal?
Ya, jelas.
Jelas Pak.
Okay, use maggot. So maggot is very important for the debridement of the wounds. And but in Indonesia, many people don't want to use it, except in Malaysia, maybe because in Malaysia the maggot still they develop about the maggot therapy for the wounds.
Yeah, betul, Pak.
Especially in University Malaya, because we have friends there. So in the clinic wound, so they use maggot for the treatment. But in Indonesia, maybe it's very difficult. Also, the situation, even though this condition with the pandemic COVID-19, the one choose we can use the maggot, because the maggot we can keep at the wounds for a long time, 3 and 4 to 5 days. We can maintain for long times, but unfortunately for this treatment, Indonesian people don't want to use it. And other question about the honey, gabus, fish.
Ya, ikan gabus, the fish.
Arwana lupa saya ininya.
Ikan gabus tuh apa ya? Arwana. Ikan apa itu?
Ikan gabus, ikan air tawar.
Air tawar.
Saya
Fresh water.
Haruan, ikan haruan.
Oh yes, haruan fish. So also in my clinic, I also advise, I recommend to the patient consume gabus, yeah, because if we want for increase the albumin level, but sorry.
Yes, sir. You can continue.
Okay. Ikan gabus, albumin level. If the patient with diabetic ulcer and all the patients who have problems, you consume ikan gabus, batasi. Oke, cukup Pak Riza.
Alright. Baik, semoga membantu dan menjawab pertanyaannya. Semuanya bisa dengar saya. I'm hearing in the help. Boleh tolong di mute semuanya terlebih dahulu.
Terima kasih Pak Suryadi.
Baik. Alright, baik. Selanjutnya ada pertanyaan dari Ati Nurse Tikes Hani Saleh untuk Pak Suryadi. Menurut Bapak, selama merawat pasien wound care, apakah ada perubahan yang signifikan bagi pasien yang juga mengalami psikologis, apalagi dengan banyaknya kasus COVID-19 sekarang ini? Apakah mereka mengalami gangguan di psikologisnya seperti itu? Mungkin maksud pertanyaan ini. Baik, Pak Suryadi, boleh dijawab. Terima kasih.
Kita pakai bahasa Indonesia, ya. Jadi,
baik, Pak, boleh.
Dengan menderita luka, khususnya di pasien pandemik ataupun pasien-pasien dengan diabetik, pasien dengan luka diabetik dan dia juga punya COVID-19, jadi luka diabetik dengan COVID-19. Ya. Hanya saja ini pasien ini tidak ada tanda dan gejala, tapi dia sudah positif dengan PCR. Jadi sangat berpengaruh dengan kondisi psikologis, juga sangat berpengaruh dengan kondisi lukanya. Yang seharusnya luka ini dengan kondisi tapi dengan ini baru dampak psikologis ini ternyata luka. Yang penting dia punya luka, kemudian dia terpapar, walaupun kecil lukanya itu sembuh gitu, agak lama sembuh. Halo. Jadi kalau pasien dengan kondisi luka, kemudian positif menderita COVID berpengaruh terutama psikologisnya. Bukan hanya fisik, tetapi logis. Karena hormon kortisol itu hanya semakin meningkat gula darah berpengaruh pada kondisi lukanya. Ini beberapa yang saya tangani dengan kondisi luka pada luka kecil, ya, cepat sekali nyebarnya gitu. Padahal lukanya kecil sekali. Ini berpengaruh kondisi psikologis. Kenapa pasien nggak bisa tidur, cemas, akan terhadap lukanya. Jadi sangat berhubungan erat kondisi politis dan isi lukanya.
Baik, terima kasih Mr. Suryadi for answering the questions. Okay, the next question. Any other questions? So we've got like 2 minutes left, and that will be the last question of this discussion session. All right, so I think if you have another questions, you can send us the messages, and then we will try to reach our speaker. So sorry for this inconvenience. We are having trouble in the internet connections. Baik. Baik, untuk selanjutnya kita bisa selingi dengan sesi door prize. Masih ada 3 pertanyaan untuk 3 langsung sampaikan sekaligus, dan nanti untuk panitia yang bisa menjawab pertanyaan door prize apabila masih mengalami kendala atau tidak bisa mendengar suara saya, Saya akan bantu coba untuk menuliskan daftar pertanyaannya dan boleh langsung dijawab. Yang pertama, apakah pembicara yang berasal dari University Malaysia Awak? Oke, boleh langsung dijawab. Jawab dengan benar beserta title-nya. Baik, untuk 10 penjawab tercepat. Sudah banyak yang masuk. Untuk pertanyaan berikutnya. Siapakah? Who is the last speaker for this session? Siapakah yang menjadi narasumber terakhir dalam sesi kali ini? Bisa dijawab dengan benar beserta title-nya. Oke, 10 orang tercepat. Oke, and then the last questions. Oke, ini pertanyaan yang paling penting. Apakah tema webinar kita hari ini? Boleh dijawab dengan lengkap, sama seperti tadi. 10 peserta yang beruntung dan tercepat akan mendapatkan paket data sebesar atau pulsa sebesar Rp50.000. Untuk pertanyaan terakhir. Baik. All right, so we've got and recorded your answers, and thank you very much for your antusiasmenya. Terima kasih banyak. Well, thank you very much for all our speakers. And then we have reached the end of our seminars. Regarding to the following questions, you may contact our committee to ask your questions, and then there will be another recording session right after this seminar, so don't worry. Ladies and gentlemen, we have reached the end of our seminar. On behalf of the organizing committee, I would like to thank for all the speakers, organizing committee, moderator, and all the participants for joining today's seminar. We hope that this seminar will bring us some knowledge in the field of wound care as well as our competence. We are looking for seeing you in the next event. Have a good day, everybody. Thank you for joining this seminar.
Thank you very much.
Thank you very much, Mr. Rizal. Do we have
Mr. Rizal?
Have a good day. Our pleasure.
Is it possible to take photo, Mr. Rizal?
All right. So we've got the session for taking pictures. Sorry.
All right. Thank you.
All right. Thank you for reminding me. And then for the committee, untuk panitianya boleh bantu untuk
ambilin mama sama ini dulu sapu.
Ya, link akhir nanti akan dikirim di grup WhatsApp ya. Oke, untuk panitia boleh dibantu untuk pin untuk speakersnya. If the speakers are still here. So we're going to have a photo session. So we are going to screenshot your screen. Apa enggak? Oke, Ibu Nisa mungkin boleh dibantu untuk screenshotnya.
Dia tinggal kirim surat apa namanya peringatan buat mereka. Aja ya di grup. Minggu depan baru pengumuman.
Pakai saus cabai atau saus?
Alright, because we are running off the time, and then some of our participants go to the mosque. And I think the committee have. Okay, so the committee has screenshot this session, and then if you have more activities to do, you may leave this group or this meeting. For those who want to go to the mosque, yang mau pergi Jumatan, boleh silakan, atau yang lainnya yang ingin meninggalkan Zoom-nya sudah diperbolehkan. Thank you for joining us today. See you in another event. Thank you. Thank you.
Terima kasih Pak Suryadi.
Thank you Pak Suryadi.
Terima kasih dari Bekasi.
Terima kasih.
Dari Stikes Bani Saleh.
Thank you.
Sama 12.
Thank you, Mr. Kaya. Thank
Alright, you may leave this Zoom
Professor
session.
Oe.
Thank you very much.
Thank you.
For all the
I love you. Thank you very much. Okay.
Keluar sendiri.
Kalau
atau hijau. Mau pedangnya